That we have discussed centric relation, maximum intercuspation and other positions of static occlusion, let us move on to another concept, which is dynamic occlusion. So in dynamic occlusion we will be discussing about what happens when the mandible moves in the eccentric positions, that is protrusive and lateral excursions. For the sake of this discussion, whenever I say the mandible moves anteriorly or protrudes, I mean when there's a translation of the mandible and the patient is physically protruding the mandible, that is sliding across the maxillary teeth. So the mandibular cusps are sliding across the maxillary teeth, and same applies to the lateral excursions. So let's begin with the two concepts that are inherent to dynamic occlusion, and these are mutually protected occlusion and group function. Now a lot of people ask me questions as to what these actually mean and what the differences are. So let me begin by saying both these schemes, that is mutually protected and group function, are seen in natural dentition. Now that is why they have come into literature. Researchers a long time ago, when they examined natural dentitions in patients' mouths, they noticed one of two things. When there were lateral excursions, when the mandible moved to the right or the left, generally on the working side, that is the side to which the mandible was going, on that side, either a single tooth like a canine or a group of teeth like a canine with premolars or just a few premolars would contact on that side, and all the other two teeth would not contact. And this gave rise to these two observations. So there was a group that focused on the canine discluding all other teeth in excursive movements, and another group that looked at other teeth like premolars in conjunction with canines and sometimes the mesiobuccal cusp of the molar, which guided the occlusion and allowed disocclusion to happen on the non-working side. So let's begin with mutually protected occlusion. Now what does the term mutually protected occlusal mean? Here what they mean to say is that they divide the ridge or the arch into the anterior and the posterior segment. Anterior segment is from one canine to the other canine, including the incisors, and the posterior segment is whatever teeth are left behind. So in a mutually protected occlusion, this eccentric relation and maximum intercuspation, the posterior teeth bear most of the forces of mastication and send the forces through their long axis and protect the relatively delicate anterior teeth from being overloaded by these muscles of mastication. So here the posterior teeth are protecting the anterior teeth in maximum intercuspation. When the jaw leaves the maximum intercuspation position, the anteriors guide the mandible. So in protrusion, the maxillary and mandibular incisors contact. So as if this is the maxillary tooth and this is the mandibular tooth, as the teeth protrude, only the maxillary and mandibular incisors touch, and all the other teeth, especially the posteriors, separate out completely from their antagonist. They do not touch any of their antagonist. So here the anterior dentition is protecting the posterior dentition from hitting into the opposing cusp in a lateral direction. So as soon as the mandible leaves maximum intercuspation, the movement is considered a lateral one, and the posterior teeth are not well equipped to take lateral loads, which is why it is called a mutually protected, which means the anterior protects the posterior from lateral forces in the excursive movements. Similarly, during the right and left excursions, the canine takes over. So the canine on the working side, if the mandible is going to the right, it's called the right working side. So the right working side canine will contact, the maxillary and mandibular canines will contact on the right side. All the other teeth will be free from occlusal contact. So this is in short what mutually protected occlusion means. Now why it was propagated was because the gnathological concept of looking at natural dentition and the gnathological system of restoration in full mouth rehabilitation were the researchers who decided that this is the most ideal scheme to have in our patients, be it natural dentition or be it prosthetically restored dentition. So that brings us to the end of what happens in mutually protected occlusion. So what you have to remember is mutually protected occlusion means canine guidance. In lateral excursions, canines touch only on the working side. In protrusive, only incisors touch, posteriors don't touch. In centric relation and MIP, where MIP coincides, The posteriors take the brunt of the force, the anteriors touch lightly. The next concept is called group function.